Okay, I'm now here with Leah, our famous model, world famous model. We're going to show you how to do cervical traction. There are two types of tractions that we utilize in this office. The first type we did with the exercise unit, and that's the static home traction that we train the patients on for actually doing at home. The second type of traction is motorized traction that we use, and they involve the use of the wall mechanism that we have here. This type of traction is aimed at trying to pull and then release and do that sequentially so that we can get some relief in disc type problems or even sometimes joint problems in the cervical spine, and we especially use these on patients with degenerative changes in their neck. Patients will sometimes ask, what is the purpose of traction? And it's to do a couple of things. One is to help decrease some of the pressure on the joint, decrease the pressure on the disc, and be able to help heal the impingement or pinching of the nerve. That will be in lay terms that I think will help them best. There are a couple of things to remember. We do not want to do this traction in extension. In other words, when the patient is laying on the table, we want to make sure that their head is either flat or slightly flexed forward toward their sternum rather than going backwards. So that's the key to positioning the pillow. So Leah, if you'll lay on your back for just a moment. If we laid her flat like this, the thing I would want to do on her is to raise up just a little bit. I want to get the pillow underneath here like this so that she's well supported underneath the shoulders, and that's where we'll decide on the angle of the head as far as the traction is concerned. Now in Leah's case, I'm okay to do her in this position because she's not a large person, and by the time we get the angle of the rope from the traction itself down here, she's going to be tending to be pulled toward the wall and a little bit upward, which will be fine. If a person tended to be a larger, more rotund person, then we might want to give them better support, and in that case we would actually double the pillow underneath like this, and you can see now how that's going to give the patient more of an upward angle. Sometimes their pain will be such that they have to be in this position anyway. Now she can see something else. If I do this, raise up again, and if I come underneath like this, then her head goes back. And so we have to raise up again. We have to watch the angle that this pillow goes underneath and make sure that we get them underneath the shoulder blades like that. That would just about be an ideal position for the traction. Now the traction harness we use will be this one, and the hookup for it are that this small portion with the straps and the buckle, as you can see, will go on the base of the skull or on the occipital area. The large portion, like this, will go underneath the chin. So I usually will start out in positioning the patient like this. Go ahead and sit up, Leah, and pretend you're a patient then. You can sit straight up. I would take this and say, I'm going to fix this pillow first, and I would lay it on the pillow like this and then tell the patient to lay back so that they don't have to lift up so much, because remember, their neck hurts, and they're going to tend to not want to have to lift up any more than necessary. Then what I would do, in a room that had Kleenex, which this does not, you know what, I'm going to grab some Kleenex. Now what I would do is take the Kleenex and fold it like this, place it onto their chin for sanitary purposes, and then bring this over to the front. Now, they won't care if their lips get touched by the Kleenex, but they really won't be happy if this gets touched by it, because so I would tend to go a little bit above it like this. And then you'll see that you'll want to center the chin with this vertical line that is right here. Okay? Then what we'll do is bring this hook up and simply hook it onto the device. We'll bring this other part up, hook it onto the device, and then the tightening we'll do will be to have it firm but comfortable for the patient. You don't want it to slide off. And you'll be able to tell if they're about the same amount by just feeling the tightness of them. Does that bother you at all? Does that feel too tight? Are you comfortable there? Okay. Once that's done, then we're in a position where this portion of the device can be hooked to the traction unit itself. And what we'll do with that is hook one hook of this, one hook of that through, and then we have the device set, and the machine is ready to go. Now when she gets under traction, we're going to generally use somewhere in the range of 12 to 16 pounds. Sometimes we may go as low as 10. That amount of traction is going to be a pull of about like this. You can see if I did that on somebody like Leah, it's so much pull when I get to like 16 pounds that it almost pulls her on the table. So she's going to be on the lighter end of that. One of the things I wanted to show with this as we do it was as you go to test this, just give a little tug on this before you turn the machine on and make sure it's not going to cram her lips. In this particular case, what I would do on Leah would be that I would slide this down just a little bit from there so that then as we actually did the traction, her mouth would feel more comfortable. Is that better?
Mm-hmm.
Okay, and then we'll be ready. You can see that it's going to pull pretty even. Does that hurt you at all?
Mm-mm.
Okay, now normally we would have the table down and we would slide this rope up, but because of room that's in here, I'm going to manually slide the table while the patient's on it. I would rather that you set the table before you start so that you don't hurt your back. Leah's light enough though that it's pretty easy, so we would move this down like this. She would be down in position. I would have already straightened the table out. And you can see that we still have room for her to go through a full cycle of tractioning and get down to somewhere in the range of about 14 pounds without this knot going inside here. That's what we don't want to have happen. Now the important thing is to get this set and then we'll turn it on. You want to set the traction while the rope is closest to the patient. When it loops around and back, that's when it's going to have maximum tension. So start in the lax area where it's in the front. We'll turn the machine on. It will start to pull back. And as it does so, you'll see the poundage reading that we get here. If it's too much poundage, then you'll simply slide this down and get it set like I have her set at 14 pounds. And that was easy. Now, once that's set, I like to have them go through one cycle. Is that uncomfortable in your mouth? Okay. Is it? Okay. I like to have them go through one cycle. I'll feel their neck muscles and make sure that they're not too uncomfortable right here. I'll watch this now. I'll tell the patient it should be lax right now, but it's going to start pulling in just a moment. Now it'll start to pull on it, and as it loops through, we'll watch to make sure one time that the poundage is correct. Then I'll tell the patient, we're going to leave the room. I'm going to give you this nurse call button so that you can call if anything goes wrong or you need help in any way. And don't change your knee positions. Now this is about the maximum pull, and she's hitting 14 exactly right now, and then it'll start to let go. So, if I was doing this in real life, I would now say to Leah, Leah, I'm going to give you this nurse call button. I expect this to not be painful. If for some reason it hurts, I want you to push that button. Secondly, I also, if you have any concern or question, or this becomes uncomfortable on another part of your body, like your back or something, just push it, we'll be right in. Secondly, now that we've set you up with your knees bent, I need you to keep them bent. If you flatten them, it'll change the poundage and could cause some problems, right? And then I would leave the room. Also, when you turn the traction off, it is best to turn the traction off on the loop when it's lax, or if you're going to turn the traction off when it's in back like this, then you want to take this rope and let it go forward so it takes the slack off. Either way doesn't matter, but the reason you want to do that is because it'll be much easier on the patient to take it off than when they have 14 pounds pulling against them. When that's done, you'll simply unhook the traction here. You'll put the device up on there, and then you'll take the traction unit itself here and hook them up through the device right there. Throw that away, and then we'll take the nurse call button and put it up. When they get up from the traction, the important thing to tell them is to turn on their side and sit up, because you have to remember that their spine has been pulled on, their muscles have been relaxed for that time, and sometimes if they sit up too quickly, they'll either get a pull in their neck or in their low back, and we don't want that to happen. We usually set traction for 8 minutes. Ultrasound, we usually do for 5 minutes. Galvanic stimulation, or HVG, we'll usually set for either 8 minutes or we'll set it for 12 minutes, depending on whether it's a 1 or a 2. And frequency-specific microcurrent we'll set for usually the 8-minute increments, unless we say differently, for whatever number of settings there are. And then for microcurrent that we use on musculoskeletal problems, We'll do the same type of setting as for galvanic stimulation, which will be a 1 or a 2, representing 8 or 12 minutes. So.